Welcome to Quality Capsule. Today we are tackling the undisputed heavyweight champion of the NCLEX, Prioritization and Delegation. Making up about 20% of your exam under the Management of Care category, this is the one topic you absolutely must master to pass. Let's break it down into a foolproof framework you can use on exam day. First up, prioritization. When the exam asks, who do you see first, your mind should immediately go to the ABCs, airway, breathing, and circulation. A patient with a sudden airway obstruction will always beat a patient with a circulatory issue. If the ABCs are stable, move to Maslow's hierarchy of needs. Physiological needs, like pain, hydration, and nutrition, always take precedence over psychological or safety needs. An unstable acute condition always trumps a stable chronic one. Remember, unexpected and acute is your priority patient. Now, let's talk about delegation. The NCLEX loves to test what you can safely hand off to an LPN or a UAP. As the registered nurse, you have an exclusive scope of practice that you cannot delegate. I call it the EAT rule: E for evaluate, A for assess, T for teach. If a task requires nursing judgment, evaluation of a patient's response, initial assessment, or patient education, it stays with the RN period. So what can you delegate? To the LPN, you can assign stable patients with expected outcomes. They can administer most medications, perform sterile procedures like inserting Foley catheters, and gather data. But they cannot do the initial assessment. To the UAP, delegate routine, non-complex tasks. Think ambulation, bathing, vital signs on stable patients, and feeding, as long as the patient doesn't have swallowing precautions. Let's look at a quick trap. A question asks you to delegate vital signs for a patient returning from surgery. Do you give it to the UAP? No. This is a post-op patient requiring a baseline assessment. That is an RN responsibility. Mastering these rules won't just earn you points, it will save you time on the hardest questions the NCLEX throws at you. Stick to the ABCs, protect your RN scope, and you'll dominate this section. Keep studying hard, and I'll see you in the next Quality Capsule breakdown.